All right, good morning. Welcome to this morning's discussion on Psyfeld. The episode is The Truth. So where would you guys like to start?
Figure out what the underlying theme is. I don't know.
Don't overthink it.
Don't overthink
Any character, any line, any scene.
I didn't remember ever seeing anything about Elaine's roommate before.
Okay.
Is she like a recurring character?
No.
I've watched like random episodes of Seinfeld, but not like the whole.
Now, what's interesting too is again, I just think that's part of production. So the answer is no, it's not a recurring
Okay.
character. But if you're viewing this 9 seasons through the psychiatrist lens, I wonder if there's something there. And again, I just think that they couldn't reach a contract or didn't think that the character development would be that critical to the comedy. But on the other end, a psychiatrist, upon hearing that, might inquire about interpersonal relationships and difficulty perhaps maintaining them, right? Which of course we know is true for Elaine, albeit we see it in the context of her boyfriends.
Right.
She can't have a meaningful relationship, intimate relationship with another person. And might that be similar to her roommates?
It just seemed like it was a character that would be recurring, like not like regularly, but like it seemed like a thing that might be like a running bit about Elaine's roommate being kind of weird or something. But
What if Elaine hypothetically did present, let's say with depression, meets criteria for Siggy caps, and also provided the information that you observed, and that we now know. I've never had a meaningful relationship with a friend. I can't keep a roommate. What's going through your mind here? And I hope it's something other than, well, let me just pull out the prescription pad.
like as far as a diagnosis or
Well, in your different, I mean, and yeah, and let's be careful. In as much as we're sitting in front of a person and they provide us this information, this chief complaint / history of present illness, the clinician really should have a provisional diagnosis come to mind, not so much because we want to rubber stamp this and get to the next med check, far from it, but instead it's going to guide us in terms of what questions will either validate or perhaps go against, rule out what we're provisionally thinking. And that's the way we form the psychiatric assessment. So it's a little bit different than we learn in M1 in terms of the structured interview. It's a structured interview, but there's immense flexibility within that structure. So yes, in terms of an illness, that will therefore guide further questioning. What comes to mind?
borderline personality
Yeah.
disorder, maybe.
Now, given that, you haven't yet discussed. No, I did say that she did endorse Siggy caps, and she meets at least 5 criteria. She's not suicidal, so we're not going to make this an acute situation. But you haven't asked about anxiety yet. You haven't asked about any features of psychosis yet. You haven't caged the patient yet. You haven't done the psychological review of systems yet. However, what pops up in your mind is borderline. So here you want to deviate from that structured interview and inquire about what.
Maybe you want to be a little circumspect with that. You could ask, like, what are the things that go wrong in relationships, and see if they say it's like another person's fault, their fault, if there's any splitting, that kind of thing.
Right. So again, in the broader context, you are now going to investigate those signs and symptoms, diagnostic criteria defining borderline. And once you've processed it, assuming that there's nothing further to do, right? Because in the line of questioning, things could come up that you think, oh, well, I need to go off on this tangent too. In the absence of that, then you resort back to asking about anxiety, psychosis, cage questions, etc., the psychological or psychiatric review of systems. All right, so I really don't know if Elaine rules in here, or knowing her for 9 years, whether she rules in, period. What I do know is that we could continue this discussion when we have our noon conference and we refocus this very clinical attention on the 2 films we're going to analyze. So anything from Elaine's roommate herself that you'd like to bring up or discuss?
And just on the topic of personality disorders, maybe she needs some schizotypal type,
Okay, what did you see?
just like the eccentric, the tribal music, the dancing, Her outfits weren't like particularly outlandish, but they were much more bold than what everyone else was wearing in the episode.
I think the earrings at one point that she took off, or so she took something off. I wasn't paying attention. I saw her like remove something when Elaine came in. Was like an earring or like necklace or something like that.
So, and let's say that we're gonna kind of just reposition this and that she, and I'm blanking on her name right now, presents to you with a chief complaint of blank. And you discover the information that was presented to us in those scenes. And so I want to make sure I frame the information correctly, because I don't want to just pathologize what she's wearing or what she does, but set it in the proper context so we can have an academic discussion as to what this may be and what may appear on your shelf exam. If you are going to choose choice A, schizotypal personality disorder, and we were able to get to Larry David before this went to production, what would you have asked him to include in the character? The formation of this character to allow for schizotypal personality to be the most likely diagnosis in this roommate.
Maybe she would display like magical thinking or have.
Crystals and stuff.
This, yeah. Yeah,
That's
like
like the
magic.
thing.
I always think of like magic and,
Mhm.
I don't know, like, I'm not familiar with how schizotypal personalities, like what their interpersonal relationships are like, but she has a boyfriend in the episode, so I'm not sure.
Yeah.
She doesn't have other friends that we see in the show, so.
Usually, I mean, there is some emotional distance that is perhaps shared with a clustered condition, the schizoid personality. But the hallmark is what you identified, the magical thinking, the bizarreness and eccentricity of behavior. And again, even though we might see eccentric behavior, even the belief in magic and or crystals, the belief in and of itself doesn't warrant any clinical attention until it does. And again, the way we presented this particular scenario, we had this particular individual present us with a chief complaint, therefore allowing for this academic discussion. So schizotypal personality, right? Odd, bizarre, eccentric behavior. Now, again, personality means that it's also pervasive. So it crosses multiple social situations and it's stable over time. So we wouldn't expect 3-4 months of this with inter episodes. This is maybe a stable, in as much as our personality characteristics and traits are stable. Yeah. And I know I kind of started the conversation off like this, but it's worth saying again, it must be clinically significant, right? There's a distinction between personality traits and personality disorder. Anytime we hear the D word, whether it's in the context of personality disorder, whether it's in the context of any other mental disorder, it must be clinically significant. It must cause clinically significant distress or impairment. Any other characters in The Truth that caught your eye?
I'm sorry, I'm kind of late. Which ones did you already talk about?
Elaine and her roommate.
In her roommate, okay. I was gonna say, we could talk a little bit about Jerry's, or not Jerry, sorry, George's like love interest in the episode of Fitting in. Obviously she's like hypersensitive to criticism, as like we found the name of the truth, the whole premise of the episode, but it almost seemed a little bit like dependent personality, like hypersensitivity fixation on like this subject in George. And then obviously like hypersensitivity to criticism and then making her go to a mental institution. And then when they go and visit him in the mental institution or her in the mental institution, he said the right things, say whatever, and then she's like falls back right back in love with him.
If you identified hypersensitivity to criticism within a case vignette on your shelf, there are 3 illnesses within the personality disorders, and it looks like this particular episode is focusing on personality. That should come to mind. You did just mention one, right? So we're looking at dependent personality, right? The individual who needs validation for their every next step, right? Some reassurance that would be considered beyond that which is really required, right? What are some other, I don't want to say mental disorders, what are some other personality disorders that are hallmarked by the hypersensitivity to criticism?
Narcissistic, yes.
Yeah. We often, we sometimes discuss this in the context of narcissistic injury.
Mhm.
But individual with this condition, a narcissistic personality disorder, can be hypersensitive to criticism because of their ego strength. And they could have very, very low self-esteem, which of course comes off as grandiosity, right? So when confronted, they can certainly demonstrate hypersensitivity, yes. Any others? Avoiding can as well. Yeah, I mean, avoidant, because it does cluster, it is cluster C, does share that overlap with dependent personality. The other one to think of is paranoid personality. People with paranoid personality have that filter in which most things are interpreted as an assault on who they are or what they're doing, right? Paranoid personality disorder, something else to consider as well. So we see this issue of hypersensitivity really cut across all three clusters, right? Avoidant cluster A, excuse me, nope, avoidant cluster C, I'm going to work backwards. Narcissistic cluster B and paranoid cluster A.
Isn't that also distributed personality too?
You could, yeah, I mean, all of cluster B are manifestations, these are traits that manifest from extremely low self-esteem. So it goes right on par with hypersensitivity. Yeah, I'm only looking at the ones that this is actually reflected in the diagnostic criteria, but you could, yes, you could definitely see it in cluster B personalities, borderline personality, even antisocial personality, histrionic, as you mentioned, quite often have very, very significantly low self-esteem. So yes. Any other characters here? We're almost halfway through.
We already talked about Kramer.
Nope.
Okay, that's always a good one.
What did you observe that's going on with Kramer?
So I mean, one of the things that I obviously noticed, it's funny that you guys were talking about schizotypal. That's what I was gonna label him as, but so like, I mean, one of the things that I noticed was when he was talking about like the mental institution, they talked about the EEG or whatever, like, or I don't know what they're talking about EEG or like electroconvulsive therapy, but he was like believing like, oh yeah, like I had a friend or whatever that had it, the synapses were just too big,
like work on
didn't work on it and stuff like that. So he kind of has like these like magical beliefs and stuff like that, and kind of just is like, if you take him on throughout the entire series, he kind of has these like odd, he's like very odd and eccentric in certain ways, and has like a few friends, but like they're always weird, or not weird, but like different. And I don't know, I would like to hear everyone's thoughts on it, because I don't think we've talked about him yet in any of these, at least that I've been here.
Well, I mean, all the people, even in like other episodes, like Frank, but all the other people he knows outside of Jerry and Elaine, like always got a buddy in this field or another, and so they're always kind of strange as well. Like see Kramer, like all the people outside of that Kramer knows, outside of Jerry, Elaine, and George, think that Kramer was normal. They all people think like the interaction he's having are very straightforward, and how like Jerry and George and Elaine watching, like kind of looking askance at the interaction.
Yeah, as a group, they almost ground him in terms of a set point from which all of his Kramer's behavior can therefore be interpreted. There's also a question if any of these individuals that Kramer very frequently references are even real. Right, there are some that do appear in episodes, but most do not. And there's even an episode, and I wish I could remember the title, and I don't, where Jerry actually, in speaking with Kramer, asks, all these people you refer to, how come we never met them? Yeah, and the answer, of course, or the intimation is that they don't exist, right? So the defense mechanism here can be fantasy. Fantasy is defined as a subconscious process. It's a process of the ego, where the individual has an autistic retreat into an inner world to protect them from the anxieties of the real world. So fantasy is completely normal when age appropriate. So if and when you walk into your daughter or son's room and they're in fantasy play, they're going to be talking to imaginary friends. They're going to have tea parties and talking to people and what's the word I'm looking for? Providing animated life to inanimate objects. You are not to call 911, right? So perfectly normal, right? Now, of course, when you see your 2-year-old do that, it's one thing, but when somebody like Kramer at about 32 is doing it, that's age inappropriate. And that's when defense mechanisms become rigid and they become maladaptive. The one condition, cluster A, that is thought to be the result of maladaptive fantasy the defense, is schizoid personality disorder. Individuals who are schizoid or emotionally distant, largely as a product of maladaptive fantasy. They have their own inner world, but it is completely separate and distant from the reality of the outer world. In addition, Kramer, some episodes, does demonstrate the eccentricity that further defines schizotypal. So his character tends to oscillate between these two conditions and reminds us that these conditions cluster. They do. And one episode we could look and say, this looks like schizoid personality disorder, answer A on that shelf exam. And then a different episode, we can actually see the eccentricity or bizarreness really come through. And then it would be choice B, schizotypal personality disorder for the same character. And so that's Kramer. Yeah, and there's even an episode, and again, I'm going to blank on this. I just watched it the other day too, where Jerry and George in Jerry's apartment are talking about Kramer. Where is he? And he's down in Florida at a fantasy camp, at a Yankee fantasy camp. And George makes the comment, Kramer's at a fantasy baseball camp. His whole life is a fantasy. Somebody, we should be plopping down hundreds of dollars to be him for a day, right? And now I don't think Larry David meant to actually drop the F-bomb outside of the context of or consistent with what the psych textbooks say. But boy, does it fit. His life is a fantasy because that's his defense, and that's his maladaptive defense. What else is going on with Kramer? Anything else that you observed?
Is this like self-centeredness? I don't know if that's the word, like it always makes me think, or not self-centeredness, but maybe it is fantasy. Just like that his fantasy is consuming and like leads him to neglect just like what happened around him. I don't know if that, like, I always think of self-centeredness as like narcissistic, but I don't think he fits the traits of like narcissistic.
Yeah, so let's call it, let's adopt the term egocentrism, right? Egocentrism is one's incapacity to view a situation from any other viewpoint but one's own. Egocentrism. And again, that could be completely normal, or it could hallmark a severe mental disorder, right? So there's a very wide continuum, very broad continuum here, and multiple etiologies. And you're exactly right. We wouldn't get an individual who is narcissistic with that level of egocentrism confused with someone like Kramer, who also has egocentrism, but it's due to that emotional distance and his actually having that quote unquote autistic retreat into this inner world. If he's operating in this inner world, he is not going to be able to make intimate connections to others. He's not going to be empathetic. He's going to remain egocentric, but it's far from narcissism. Right. So that I believe is the etiology. And he shows this episode after episode where out of the mouth of babes. Again, he's stuck in this fantasy world like a 2-year-old would be. If you don't want to know the truth in terms of the mirror being held up to you, do not get in front of a 2-year-old or 3-year-old. Right. There's going to be no filter there. They haven't learned that part of their cortex has not been fully developed where they're going to tell you the God's honest truth, period. Well, so does Kramer, even at his advanced age, and that's largely a product of his being in that autistic world that he operates in, that inner world, right? He just doesn't connect to it, and there's multiple episodes that highlight this. Right? I mean, his friends will actually say, "Well, let's put her in front of Kramer." He'll tell her how bad that hairdo is, right? It's socially inappropriate for us to actually say something like that, but Kramer will do it. It's because its mind operates with that level of egocentrism.
And even in the episode when he like walks in on a lane changing and naked and stuff like that, he seems to have no issue with it.
Yeah. And you can't pick up on social cues because those social cues operate in the outer world, right? He just hasn't picked up on that. It hasn't been developed. Now, we don't know why. Early childhood trauma usually has the individual remain in their fantasy world because that's where it's safe. Right? Children may learn very, very young that outside world is just overblown with threats. and it's easier. And that's Elijah Price's character in M. Night Shyamalan's Unbreakable,
Mhm.
right? I mean, the outside world has given him this brittle bone disease called osteogenesis imperfecta. And it prevents him from making friends and real connections to the outside world. Remember, his mother puts that comic book on that park bench outside to get him to go outside because he'll never leave that room. He's in that fantasy world.
Mhm.
Unfortunately, it doesn't work. And he incorporates the comic and the comic universe into his own inner world and builds this delusional system as a result. No more spoilers, but early childhood trauma. In Elijah's case, it's due to a physical disease. Kramer's case, there is an episode where we're first introduced to his mom, Babs, and learned that his real name is Cosmo. And there are comments made that he doesn't want to reconnect with his mother. There's too much pain there. So there's something there. And there's also that pertinent negative as well, in that we never hear about Kramer's father. By the way, it's also written in the script that his mother is afflicted with alcohol use disorder because upon reuniting with her, he asks if she's clean. Right. So if there's early childhood trauma, if that family dynamic without father, which is traumatic enough, also has an alcoholic mother, we could begin to kind of build this this narrative, this past psychiatric issue or developmental history as to why Kramer has developed this defense mechanism. Have about 5 minutes left. Any other characters you want to discuss today?
Right?
I guess kind of going back to the egocentric, you could kind of throw Jerry in there too. In terms of like throughout this entire episode, the only thing he's concerned about is like tax papers. Like throughout.
I think Jerry fall more into like the sociopath kind of thing because he's very like egocentric, but he doesn't seem that sensitive to criticism. He never seems to react very emotionally. He's always kind of making jokes and just go right.
Yeah, so I think there are a couple things operating here. And the answer is yes, he is egocentric. All four characters are egocentric, although they're coming from four different perspectives, four different ideologies, which make this, in my opinion, makes this the best situational comedy ever made. And I think even Larry David would tell you that he built the characters like that. And we know, and I don't care about the spoiler here, the finale and the second part of the finale, they end up in jail. For that very reason, because of their egocentrism, their inability or incapacity to connect to others. That drives this whole narrative for 9 full seasons. There's no doubt about that. Jerry, however, incorporates another defense that gets him by this. That is, we see multiple reactions by him that do not appear to be consistent with this hypersensitivity to criticism, and he clearly isn't. That said, the defense that he uses, of course, is humor. And it gets to a point where it does become maladaptive, despite the fact that he's literally made a career of this. And I'm talking about Jerry Seinfeld, the character, not the person, and not the actor. And that's because, and he's grounded here by his ex, and now very close friend, Elaine, who in multiple episodes says, I got to get new friends. And multiple times calls Jerry to his face immature. Right? So even though Valiant, in initially classifying these defense mechanisms, thought of humor as being a mature defense, mature narcissistic, that classification system's outdated. It's really adaptive or maladaptive. And even though humor would, in the textbook and perhaps even on a shelf exam, be considered to be quote unquote mature, we could see, certainly in watching Seinfeld and Seinfeld the series and identifying Jerry Seinfeld, the character, we can see how this mature defense can become quite maladaptive, and Elaine even says so. All right, we're 25 after. We're going to log off here and end it here. Welcome everybody back at noon to discuss our films. And for those on Zoom, we're going to log right back on the other link to begin table rounds.
Is humor its own defense, or does it fit into